Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A study published in the journal Circulation in September 2021 showed that a healthy eating program, weight loss, and improved aerobic fitness can significantly reduce blood pressure and improve heart health in people with resistant hypertension. So resistant hypertension is defined as uncontrolled high blood pressure over 130/80, despite the use of 3 or more high blood pressure medications of different classes. So these are people who have high blood pressure. They're on 3 or 4 or even more medications of different classes to bring their blood pressure down, and it still is not bringing it down into the safe range. This is known as resistant hypertension. Although estimates vary, resistant hypertension likely affects about 5% of the general population and may affect 20 to 30% of adults who have been diagnosed with high blood pressure. So it's a very common problem not to be able to get blood pressure into the normal range using medication alone. So resistant hypertension is a dangerous problem to contend with, as it's associated with end organ damage such as kidney failure and a 50% greater risk of adverse cardiovascular events including stroke and heart attack and sudden death. So anything that can be done to reduce blood pressure in these individuals should be taken seriously. And that's what this research is all about in this particular publication that was just came out in the journal Circulation. So in June of 2021, the American Heart Association advised that physical activity is the optimal first treatment choice for adults with mild to moderately elevated blood pressure and blood cholesterol who otherwise have low heart disease risk. So in other words, individuals with no other risk factors for heart disease who have mild to moderate high blood pressure and or high cholesterol, that exercise should be the very first choice of implementation to bring those values lower. Now, the September 2021 study in the journal Circulation, the study was called the Treating Resistant Hypertension Using Lifestyle Modification to Promote Health, or the TRIUMPH study, was the first to evaluate the impact of lifestyle modifications in people with resistant hypertension. The 4-month study involved 140 adults with resistant hypertension, whereby about half the participants were assigned to what's known as the DASH eating plan, which is rich in fruits and vegetables, low-fat dairy products with limited salt intake, which aligns with the American Heart Association's nutrition recommendations. They also performed exercise training in a supervised cardiac rehabilitation setting 3 times a week. So they made dietary changes and they exercised 3 times a week under supervision. The second group received just a single information session from a health educator and written guidelines on exercise, weight loss, and nutritional goals to follow on their own. So they were more self-guided. They got 1 educational session, then they were left to their own devices to try to make it work, whereas the first group had supervised exercise. So the average age of the participants was 63 years old. 48% were women, 59% were black adults, 31% had type 2 diabetes, and 21% had existing chronic kidney disease. So an older population with some compromised health issues to begin with in many cases. The results showed that participants in the supervised exercise program had about a 12-point drop in systolic blood pressure. That's critically, and it's a huge drop in people who have resistant hypertension to bring their systolic blood pressure down another 12 points. In the self-guided group who had just the 1 educational session around diet and exercise, even those individuals had a 7-point drop in blood pressure just from trying to put some of these interventions into their own life, sort of in their own self-guided way. Participants in the supervised program also had a greater improvement in other key indicators of heart health, suggesting that they had a lower risk of having heart events in the future. So one of the researchers, Dr. Blumenthal, commented. He said this: "Our findings showed lifestyle modifications among people with resistant hypertension can help them successfully lose weight and increase their physical activity, and as a result, lower blood pressure and potentially reduce their risk of heart attack or stroke." He also noted, and I quote, "The success of the supervised program doesn't mean people with resistant hypertension can stop taking their medications. However, it suggests that they might want to talk to their physicians about possibly reducing the dosage or altering their medications based upon their lower blood pressure values that were due to their lifestyle modification practices." Then he concluded, the most important point is that it's not too late for almost anybody to lower blood pressure by making healthy lifestyle choices. Adopting a healthy lifestyle pays huge dividends, even for people whose blood pressure remains elevated despite being on 3 or 4 antihypertensive medications, he commented. So in my personal experience, many physicians fail to emphasize the meaningful therapeutic effects of targeted dietary and exercise protocols for patients with high blood pressure and resistant hypertension. Diet and exercise exert really important medicinal effects on the body in both preventing high blood pressure and helping to treat high blood pressure, including helping those with dangerous resistant hypertension. Once again illustrating that lifestyle medicine should be a key component of self-health care throughout your entire life. So I've included the reference for this information in the text below. Thanks for watching, and I'll see you next time.